Knock, knock.
Come in.
Hello, my name is Jennifer Hunt. I'm a Nevada State College nursing student, and I'm going to be assisting your nurse today. The doctor has an order for an IV placement. Have you ever had one before?
Yes.
Okay. And do you have any questions for me?
No.
Okay. And can I get your full name and your date of birth?
Jeanette Ayan 9/13/74.
Okay, great. And do you have any allergies to latex or adhesives or chlorhexidine?
Nope.
Okay. And have you had any trauma or injury to your arms? Any dialysis ports or mastectomy?
Nope.
Okay. All right. So let's get started. First, I'm gonna hang an IV. I have my solution. I look at it and see if it's cloudy. It's clear. It's 100 milliliters, and let's see, and it's not expired. I'm going to be sure not to touch the ends of these. They need to remain sterile because fluid will be going into the patient. And this is closed. And then I hang my solution. I squeeze this until it fills halfway. And now I want to prime my line. And make sure that there are no air bubbles. I'm going to have a trash can here or a sink. I'm going to make sure that there are no air bubbles in the line to prevent air embolism. Okay. All the bubbles. The line is clear. So I'm going to hang this for later. I just don't want it to be near that blood. Okay, now we're going to start the IV. Have my one-way valve. Expiration's good. I have my pigtail, and expiration is good. I have my IV starter kit, and everything is good. Expiration. Okay, so
15 to 30 angle.
okay, so I'm gonna initial and date, and you do the gauge, write it on there because I don't like writing on their skin. So I'm gonna do that first for my dressing.
Okay. We're gonna place pressure. This way the blood doesn't get anywhere. Okay. You just need to watch this word real quick, okay? Alright, I'm going to put some tape on you, okay?
For an IV. Have you ever had an IV before? I have. Okay. Have you had any
so this tape we're going to initial. We're going to put the time and the date of when the IV was started and the gauge that we have used.
Okay.
Have that on there. Our 22 gauge.
Mess that up.
So that would be written down on
Okay.
this label.
Alright, so the next thing I'm going to do is I'm going to look at my supplies and get everything ready for my So I'll be right back. And I'll go ahead and everything ready.
Still doing my penis still? Did I hurt it all?
So, yeah.
Make sure not to touch any of the ends.
Alright, so the next thing we're going to do is tape up our cord. This way it doesn't interfere with
Okay.
activities.
I'm going to put this
Make sure you got all those fluids.
here to keep it nice and clean.
Best we can. Sorry there was no more.
And all of this would be done after we have flushed the IV to make sure that it's patent. Okay. Right, so we're going to secure. So your hand.
Got my gauze,
There we go, got him on.
chlorhexidine, my tape,
So the first thing I'm going to do is
and
Alright.
Sky.
We're gonna flush again to make sure
Okay,
that
if you
it's
can
all
lift up your
patent.
arm a little bit, I'm just going to check out your veins and see which one to use. I'm going to go 6 to 8 inches above the IV site. I'm going to go pretty tight on this. Secure it. And then I'm going to palpate and inspect the hand. This is a nice bouncy vein, so I'm going to release the tourniquet and prepare stuff. Make sure that I have everything prepared so that the tourniquet isn't on the patient for a long time. So it seems like everything's prepared.
Then I'm going to make sure. Open up my Open up my clamp and make sure.
Okay.
Get it all primed and ready to go and watch for, make sure that there's no air bubbles. Hold on one second.
Alright, and we see it running. Okay. Alright, so your IV is in, so at this point we would
And then I'm going to go ahead and slowly release my clamp and then make sure that I get all my air bubbles out of my
we put the IV in, what gauge you
Start in the middle and circle out,
our name, our date of birth,
and then go crossways. And I'm going to do that for 30 seconds.
that I put it in,
I'm going to let that dry.
and the appearance of the site.
Got the air bubbles
Okay,
out.
so now we're going to discontinue your
Okay, let's say that this is dry. I'm just going to dry it off a little bit. Now I'm going to start the IV.
Knock on the door, reintroduce myself. Hi. Okay, I'm getting ready to do your IV now, and I'm actually going to go grab some gloves because I can see that I'm out. So
Okay, alright, so we're going to take this off right now, okay? Remove our tape.
Okay, so I find the IV, that's nice and good. I have the bevel side up.
Okay, so I'm hand hygiene, obviously. Now I'm going to put my gloves on and get things ready to put together.
Bevel side. I'm going to release this, make sure it slides okay.
Alright, so we're going to put pressure on here.
Okay.
Alright, so you want to just put
I'm going to
pressure on
stabilize
for 10 minutes.
the vein with my thumb and then go in at a 15 to 30 degree angle.
Okay. Alright, so at this point, we would have documented the distal ventilation. We're going to document that our catheter is still intact. That
And wait for a flash. I have a flash.
our
I'm going to put the needle parallel to the skin, push in a little bit more.
tolerated this as well. And before, when we were inserting the needle, we would have put it into our sharp system to take the IV.
And I'm going to insert the catheter.
Okay, Miss Stone, you're all done for today. Your call light is right up
Occlude
there
the
if you need
vein.
me, okay, I'm just going to discard my supply.
Go to the sharps and then attach. And now I'm going to flush. I'm going to release the tourniquet and flush. I look at the site and everything's good. It's not puffing out or anything.
It's going to be a little bit tighter. I'll try to be quick about it. That way it won't be on too long. Let's try that again.
Clean that up a little bit.
So the first thing I'm going to do is I'm going to clean it all up. And we do it for 30 seconds, so we start out. I'm good. 2, 3.
And I have my initials, date, and gauge used. Okay, and now I'm going to place tape.
And then we're going to come to the gate and we're going to hold the skin taut. And then as we enter, oh my God, those gloves are like. Once we have our flash of blood, we're going to go ahead and put the attachment on.
Actually, I'm not going to put that over there, over the tape. I'm going to do this. Okay.
You're trying to show it to
Loop it around. Secure the tubing. Okay. Take that off. And now I'm going to make sure that tape sticks. Now I'm going to hook up the line if needed. And I just hook it up. I would actually swab the end of the port, the valve, for 30 seconds. And then attach this to the patient. Okay. All right, so now I have an order to remove the IV. I already introduced myself, did hand hygiene, put on gloves, confirmed patient's name, and I have my doctor's order. Oh, actually, before that, I would document placing the IV, and I would note the date, the gauge, the length of the needle, and how the patient responded, how many times I had to do it, and that was once. What arm and what vein, and I think that's it. Now I have an order to take out the IV. I already did hand hygiene, confirmed the client's name, introduced myself, and assessed everything on the hand. And then now I'm going to remove the IV. So already did hand hygiene, put on gloves. And then, so now I'm going to take out the IV. What I'm going to do is I'm going to flush out the vein, make sure that any medicine that's in the tubing gets flushed out so that the client doesn't get a rush of medicine. Oh, before that, forgot. Before I attach that, I use an alcohol wipe for 30 seconds on the port. And I take a new syringe and I flush out. Open that, flush out the vein. Looks good. Okay. Close that up. Okay. Have my gauze.
What's Gina's on? Yeah, so Miss Smith. You don't look good like that. Stop it.
Hi, I'm Sharon. Back again. That's
I'm going to take off the bandage from the edges to the site and take off the bandage that is closest to the skin. Keep this steady. Okay. Straight out. And I look at the catheter, and the catheter looks good. It's intact. I put that in the sharps container. Have them hold that. Okay. And there's no issues with the vein, so I would document when it was taken out, the time, the date, how the patient responded, and how the catheter, if it was intact, and what vein I took it out of. And that's it.